Hi everyone, very good morning, guys. I hope I am audible and visible to all of you. Can I get a quick confirmation, please? And we would start the session right away. And I want to first and foremost welcome all of you towards this session because this seems to be more important than all the academic sessions that we've conducted all throughout these months and years, because this is the session where we probably need to talk to each other the most, because I think whatever's being projected on the screen right now, this is our exact state of mind. And some of us are sulking over it, some of us are just too panicky about it, some of us have our anxiety levels crossing all borders. So I think this is something which either of these is one of the thoughts, or probably a mixture of all these thoughts that each one of us, and honestly, trust me, including myself, because at this point of time, whenever and every year when a batch goes into the exam, there is always a feeling that you yourself are also going in for the exam, because you've seen the entire journey. You've, in a way, maybe not completely, but partly lived with the students in that journey. So it does feel that there is a major life changing event that is going to happen. And this is exactly the kind of thoughts that I have also woken up early morning with, or probably have been having since the past few hours. So maybe not 100% if I can, think at the same page as you guys, at least half of what you are feeling, the same is happening inside. So I think at this point of time, what we actually need to practice and what will, help us the most is, trust me, this is something which I can swear by, my swear by thing, that breathing exercises at this point of time help the most. Breathe in, hold, and breathe out. And not only right now, even in the examination hall, when there will be a patch, guys, please remember, in the exam hall, there will be a patch where 2, 3 questions at a stretch, and you will feel, I've not got them right, I've never heard of them, I have no idea about them, and you'll feel that all of a sudden you'll feel your boat is going to drown. And this is something which you can actually practice even in the exam, because it helps you relieve a lot of anxiety in there. Okay, so having said that, what all do we think at this point of time? Acha, so first and foremost, many of you asking me, ma'am, what to revise in neoplasia right now. So I will tell you what to revise, although today is a day where I don't want you to burden yourself with anything that is text heavy, but I'll let you know. I just want you to, first calm yourself down, because most of you are in this state of mind. You are overthinking, and that's natural. It's not something unnatural that you're doing. You're just thinking way too much, and I think each one of us is in the same boat. But what is killing a lot of things at this point of time is that your effort of so many months, so many years, and so much of hard work that you've put in, so many sacrifices that you've done, all of that is somewhere going down, because you're getting a lot of, you're very fearful. And what are you fearful about? A lot of things. Maybe this is just an exam for some people. For others, this is a source of an income in the future. For the others, it is a monetary pressure. For there are some for whom it is peer pressure. For some, it is familial pressure. So a lot of pressures that you're dealing with, and those pressures are somewhere stemming up for all those fears that are coming up your way. So right now, if all these things are not letting you study, first you need to give yourself that leverage that it's totally normal and natural. And if I'm not able to study for an hour or two, it's perfectly fine. Don't pressurize yourself. Be practical in that way. My first and only advice to all of you is, you have really worked hard. See, maybe I have not been with you 24/7 to see how many hours you've put in per day, but at least I've met you once every day, maybe in the morning or in the evening. So somewhere I do know, and I have that faith and confidence in you guys, that you have worked hard. Now come on, who wakes up at 7:30, or even if you wake up early, who attends a class 7:30 each morning without fail? And that has been you. So have that faith. And that was not the only class that you were attending. I mean, you were after that also studying on your own, giving your mock tests, attending classes in the evening, attending midnight sessions, attending YouTube sessions. So I don't know, where are you losing out on the faith on yourself, and why are you letting the fear overcome? Because your faith at this point of time has to be bigger than your fear. Your faith and the trust that you have in yourself. I can come the entire day and keep counseling you and motivating you for 24 hours till your exam next morning. But trust me, at this point of time, you are your best counselor. You are the only one. You have to actually, I'm not saying be overconfident, but you have to have confidence and you have to tell yourself of all the good things that you've done. Like I told you that, you wake up each morning. That should somewhere get you that faith that, if I've done so much of hard work all these months, I cannot let that go down the drain just because at this point of time I'm feeling anxious or panicky or I'm having palpitations or I'm feeling very fidgety and I don't know what to study. So similarly, you have to remind yourself right from your childhood up till today of everything that you've put out to become a better version of yourself. You have to remind yourself about all those sleepless nights, all those exam days, all those prof exams, all those medals and good chits and good certificates that you've earned yourself, and all the pride that you bring to yourself and your family. That is the kind of positivity that you need to give out to the universe at this point of time, because I don't know how many of you have heard it, but whatever you're giving out at this point of time, whatever kind of energies and vibes you're giving out at this point of time, it'll come a full circle. It's all going to come back to you tomorrow morning when you sit for the exam. If you're constantly thinking, ma'am, nahi hone wala, I don't think, I've wasted my time, it's all down the drain, should I even go for the exam? If you have these kind of negative thoughts, you're entering the exam hall with those negative thoughts, and obviously the same will project onto the questions also that you perform. So somewhere you definitely have to give out that positivity and have faith that the exam will give you that positivity back. And most of you see, many of us have different outcomes of this exam, and I actually want you at this point of time, I just want you to think, why are you giving this exam? Is it only for a degree? Is it for a better job prospect? Is it better income? Is it to fulfill your dream or your parents' dream? So these are many things as to why you started. Everyone has multiple reasons, but everyone has that one main reason as to why you started out on this journey. Everyone is not doing, some of you feel that it's a better social status because after MBBS I'll have an MD degree in front of my name. Some of you are doing it for your passion because you want to do a specialization in a particular subject that has been your childhood dream ever since. So whatever you started off with, and then many other things took over, but whatever you started off with, that one aim with which you started off, that is what you have to remember. So remember your aim, remember your goal, remember your reason. And what you don't have to remember, you don't have to remember this. So many of us at this point of time are, obviously we are worried because it's our childhood dream to accomplish this, and we are worried that what if we don't. But many of us are also worried about what people will say. And who are these four people? These four people have probably ruined more lives in our country than anything or anyone could have. And these are the four people which your parents keep telling you about. These are the four people who probably scare you in your nightmares. So these are the people that you don't have to think about. You clear this exam, it's none of their concern. You don't clear this exam is also none of their concern. The happiness is yours and the sadness will be yours as well. So these four people could be your friends who are not wishing well for you. These could definitely be your relatives, 100%, who are somewhere waiting that you will come out with the news that you could not do well. These could be your neighbors, and these could be just random people on the road who don't know you, but you are worrying a lot about them. So you're probably very worried about, what if I don't, many of us are in that state, that what if I don't do well? What will these set of four people in their early morning gossip tea session say about me? And that should not matter, because they have had far more failures than you in life, and that is the reason that they are sitting and discussing all of this every morning over a gossip session. So please remember, what people are going to say on your success or on your failure, either ways, I'm not saying that be happy when they praise you, but similarly don't be sad when they demean you or when they put you down. So if you're worried about the exam because of these set of four people, please do not, because honestly telling you, they really don't care. People who are reaching out to you at this point of time and asking you, or pad liya, tayari ho gayi, are you well prepared, those kind of people practically are not bothered about what you're doing. They are only wanting to hear that one element of bad news, that oh, you are anxious. They'll be more happy to hear things like, I'm very anxious, or I am, if you say that I've forgotten everything, or if you say that I don't think I should even give this exam, maybe I should attempt next time. So this is exactly what they want to hear from you. And when you On the contrary, when you tell them that, I've given my 100% and let's see what happens tomorrow, that is something that will push them back. So remember, what you have to think about is all your accomplishments till date, and what you don't have to think about are these set of 4 useless people that practically make no difference in anyone's life. Now coming back, what to do today and what to do tomorrow. So first and foremost, the mantra for today that I can say is going to be very basic, a very basic lifestyle, that is eat right and sleep tight. Swear by this today, at least after evening. Eat right because you have an early morning exam, but don't eat just before the exam, because someone wrote to me this morning only. This morning, one student, every time students write to me, ma'am, I'm anxious, I'm panicky. So one student gave me such an apt description and wrote to me in the morning that, ma'am, there's something good happening in my stomach. And that couldn't have been a more appropriate description of what each one of us is going through. So, all these big words like anxiety and panic and all this, we just loosely use whenever we feel that, something wrong is happening. But that feeling in the stomach is actually the real, the real essence of the thing that we have. And each one of us is going to have it till tomorrow morning. So that good feeling in the stomach will even worsen if you just eat something very heavy just half an hour before the exam. Or if you're traveling to a distant place, please keep in mind your motion sickness and other factors. But for today, it is going to be eat right and sleep tight, first thing. Second thing, everything right now, early morning after this session, whatever printouts you have to take, ID cards, admit card, whatever you want to keep ready for your journey, for your travel, maybe a medicine kit, maybe any last minute small copy that you had made, which you might be traveling today, you might want to read through that. All of that, keep it ready right after this session at 8:30. Don't delay it for evening, because anything you miss out in the evening, that is going to cost you a lot tomorrow morning. And after evening, try not to study. I know I'm not saying not to study means you just keep talking to each other about all the negativity that is going on. When I say try not to study, means go for a light walk, eat well, take a good night's sleep, talk to your family, talk to your parents, your siblings, or whosoever gives you that calming effect. Whosoever makes you calm, makes you, gives you that soothing effect in your life, you know that person best. It could be your mom, your dad, your siblings, your maybe a very close friend, but whosoever is able to calm you down, that person is whom you should be talking to after the late evening hours. Okay, now what in the exam hall? Okay, so yes, I'll be coming to your queries also, but what in the exam all, and I can see that, ma'am, so much of it is still left untouched. Pseudo confidence he help aega. Yes, see, we've always heard overconfidence killed the cat. Overconfidence is something you don't have to keep. You don't have to go with the thought that I know everything and I am the best and I will top this exam. You're not, even the topper never goes with that kind of a confidence that I'm going to top the exam. Overconfidence is bad, but then so is underconfidence. So where do you settle it? You settle it somewhere as pseudo confidence. Exactly how you said it, Dr. Sneha. Because pseudo confidence, and there's a very thin line. Pseudo confidence means that everyone, trust me, it's not just you, each one of us has a long list of things जो कभी नहीं पढ़ा. But जो कभी नहीं पढ़ा वो अब भी नहीं पढ़ना. That is the rule for the day. You don't have to sit and read all those new things. I'll tell you, for example, each one of us, trust me, even if you've been studying for 6 years for this exam, there will be a list of approximately 1000 topics which you've not touched, because medical profession is like that. No one can read everything. No one will ever know everything, right? So when you start, can you read those 1000 topics today? You cannot. You read 1, 2, 50 or 100, but then you're putting your mind into that cycle that I did not know these 50 topics, means I don't know the rest of the 950 topics also, and your confidence level will automatically keep going down. How do you maintain the pseudo confidence? Please do not read anything that is new at this point of time. Only sit and revise the volatile topics. Okay, now having said that, Okay, someone says that, ma'am, even in my, other than my stomach, even in my throat, I'm feeling that kind of a good wala feeling. It's totally understandable, and that is how anxiety feels like. So, for those who've never faced anxiety, this is exactly how an anxious person describes himself. So, this is just your probably first face-to-face encounter with anxiety, and I hope, with fingers crossed, that it's the last one. But right now, survival is the best. So, first thing, guys, let's come down to the points that you have to follow. Be practical. Do not give yourself a list of 1000 topics that you have to revise today, which all of you want, all of us want. Even I would want that, what if I can use 19 hours today for the revision of 19 subjects, and I wish I could do that and I had the superpowers to do that, but God has not given us those kind of superpowers and mega brains. So it's better that let's be practical. Let's pick up, say for example, 40 to 50 volatile lists that I had to discuss or I had to revise, which you know best. It could be biochemistry, it could be micro, it could be path, but those maximum 40 to 50 topics which you wrap up by late evening and then you shut your book. So be practical. You are not going to revise everything. Second, what about in the exam? During the exam, this is what you should be doing and this is what you should not be doing. Means when you look at a question, you have to practice common sense. Common sense is obviously becoming very uncommon nowadays, but whenever you're looking at a question, I mean to say straight thinking, you have to look at it with two aspects. Common things will be asked first, number one, and number two, the instinct, the first instinct is going to help you in the paper, versus when you start doing this, when you start thinking, overthinking that मैम ने ये पढ़ाया था but वो वाले सर ने वो पढ़ाया था, and then my friend said that that topic is also going to come, and then I'm going to think that, oh, this can't be such an easy question also. Then one thought is really something which is bad, which you feel underconfidence. When you get an answer easily, you feel इतना easy तो नहीं होगा. It won't be that simple. I have also got it. Why will they give such a simple question in the paper? There is a trick in this. There is some twist in the story which I am not able to get. And then those twists and turns in the story get you to that horrible answer which you don't want to mark. So remember, first think straight, think common things first. Common things there will be only one or two or maximum three questions in the paper which will be diseases which are less than 1% incidence. Those kind of diseases will be 1, 2 or 3 questions. The rest of the 197 questions are definitely going to be the common things. So you don't want to miss out on those just because you're thinking of that 1% rare disease that you want to mark, and by getting that one question right, you'll miss out on 199 and you don't want to go by that. So remember, let the gut do the talking tomorrow. Gut feeling really works. And there's another problem. Many of you, I'm sure, will Dr. Ipsita, yes, I'll talk to you also. Don't worry. Exactly why this session is all about. Tomorrow, the first thing, let the gut do the talking. Tomorrow, you will see that whenever you look at, even this used to happen in Kickstart morning sessions, when you had a poll in front of you, sometimes you used to mark something and you used to say that, ma'am, socha to yahi tha. Then I thought that, why would you give us such a simple question? Then I marked it the other way around. So basically, overthinking is something that will kill you. And when do you overthink? I'll tell you what. You read a question and then you think of an answer, but then we are the kings and queens of procrastination. Then we feel that nahi, ye answer aa gaya means I have done something wrong, because how can I get such a simple question in the paper? Then comes the deadly thing, mark for review, and you say that I will mark it for review and later on I will come back to it and I will do this tough question aram se. I will take 2-3 minutes on it and then I will get the right answer, and then what you get is the wrong answer. So I'm not saying marking for review is a bad thing, but like I said, we are the kings and queens of procrastination. We have been doing that all our preparation. We have probably been doing that all our lives, but the problem is we even do it within the exam hall. And I'll tell you how. See, whenever I used to tell you that pathology pad lo, read pathology, you have 4 days for pathology, what did you do? You always used to study easy things, like you used to say, ma'am cell injury easy hai, today I will do cell injury because that's easy. Neoplasia ma'am is very tough. Neoplasia I will do on the last day. Today I'll feel no, today my mind is not ready for neoplasia. That I will do tomorrow. And then tomorrow you used to say day after, because that's how the human mind and human system works. We leave the tougher things for later. My advice to you is, don't be procrastination kings and queens in the paper. Every question that you come to, don't feel ये tough लग रहा है बाद में देखेंगे, let me just do kind of easy things, let me quickly attempt, and then all the tough things I'll leave in the end, because that is not how it works. For those who are asking me about how to proceed, you have ideally there are two ways. Either you can go in for 60 questions in the first 1 hour, 70 and 70 in the second hour, and this could also be a 65. Why have I kept less? I would personally go for this because knowing myself, everyone works differently. So I always, if I know myself, I know that I would, in the first 5-7 minutes, my mind would be in all directions. So settling down in the first 1 hour is very important. And in that settling down phase, when you burden yourself with 70 questions, probably that is when your errors and silly mistakes will start happening. So in the first 1 hour, I would personally feel that 60 questions is fine. Okay, if you are confident enough, stretch it up to a 65, but don't keep a target of 70, because somewhere give yourself that time to settle down, because you are dealing with a technical thing, you're dealing with a computer, minor glitches come up. You sometimes feel that you're not very comfortable with the kind of computer that they've given you, or the mouse that they've given you. So random things pop up. So you need to give yourself those additional 5 minutes of just getting yourself comfortable, getting your heart rate back to normal, getting rid of that tachycardia and that anxiety. So I would suggest a 60-70-70, and then you have 30 minutes for all that procrastination that you've done through the exam and all those things that you've marked for review. But remember, review should genuinely be for things like, for example, you get a question on catalase positive organisms. Now you feel that padha to tha, but I'm not able to. I genuinely know I've studied this. I've studied this a million times, but suddenly my mind has undergone a block. Okay, I'll leave it for review because I know that I'll be able to recall it. Right now, I'm not in the correct frame of mind. I need 15, 20, 30 minutes. I know my mind will settle, and somewhere on some other question, that mnemonic will pop up. Those lists will pop up, and I know my mind will be able to recall. Just that right now there's a mind block. So yeah, let's leave it for review. Let me come back to it later on. But don't leave questions for review where you know the answer, but you're feeling, nahi, ek baar dobara dekh lenge. These are the kind of things which you guys do, which all of us do, not just you. All of us do this. Ek baar dobara. What's the harm in looking at it? Let me mark everything for review, because once more I look at it, double check ho jayega. I'll have a double check. I'll be able to go through it. I'll be more confident. Maybe I'm missing out on something. Don't leave those kind of questions for review, because you won't be able to come back to everything for review. And in that scenario, these genuine questions which you had to leave for review, you'll end up missing out on those as well, right? So remember, 60-70-70 is what you follow. And while you are following this in the exam, how to deal with the most problematic situation in the NEET PG options. You will have 4 options, and 2 options every person will be able to eliminate. 2 options is where you will be stuck with. Remember, I've always said competitive exams, if these are the 4 options, competitive exams are not about finding the correct answer. Competitive exams are about ruling out. Remember, okay, I'll give you a very simple day-to-day example. Something that everyone will relate to. I think the biggest problem that we have when we don't have exams is we have a million online OTT platforms. What to watch? How many of you have had this problem? Go back to normal life, get a little away from the exam, think of normal life, when life was normal and life was routine and general. Then you used to feel that, okay, I have subscription for these 7-8 things, and I have passwords of my friends and everything. But dekhna kya hai? Ya fir when you go to a restaurant and you're like, what do I have to eat, or what do I want to eat? So that's the biggest confusion of a regular person. A non-medico has these kind of confusions in life. We have other confusions about those char log in our life, but non-medicos have these kind of confusion. कौन सा Netflix पे क्या देखना है? I'm going out, so what do I have to eat? So when you're going through a set of movies or a set of web series, do you actually pick out or do you actually rule out? You always feel, okay, thriller is something, no, I don't really want to watch that. Rom-coms, I'm not in the mood of. Okay, so maybe some action movie, yeah, that I can watch. And then that is how you come down to it. So always remember, in life also you practice this. In life, you don't select the one best thing. You always weigh pros and cons and you rule out things in life. When you go out to eat, you always say, no, I don't feel like eating anything sweet. That is why I'll have something salty. Exactly same thing you have to do in the NEET PG. You will never find the best decision of your life. There will be no single answer which will be, हाँ ये तो पक्का है. You will always come down to answers by eliminating options. Remember, targeting the answer is not the rule over here. Eliminating the options is the rule over here. Exactly how, see, when I used to teach you in Kickstart mornings, you always used to say, ma'am, baki ke options bhi bata do. Tell us the other options also. Answer you've told us, but tell us the other options. And that is how we used to study. And same, remember, your exam should be just like a Kickstart morning session, just with a little bit of more pressure probably. But other than that, the questions, the options, the timing, the way of attempting, early morning sleepiness, all of that is going to be similar to a Kickstart morning session, and when, or maybe like a grand test that you were giving. And when you go with that kind of a mindset, it will definitely be simpler for yourself in terms of your mental health, and it's also going to be better in the outcome and the result that you're going to get, right? So remember, yes, I can see, and what I'm really liking out here is how empathetic all of you are towards each other, because all of you are somewhere, everyone is in the same boat. I don't know whether I can say we are all sailing in the same boat, or whether at this point of time you are feeling that, ma'am, we are drowning in the same gutter. I don't know what exactly is your thought. Probably all of you feel that, no, ma'am, we are not sailing at all in any kind of boat, we are drowning in a gutter. But the good news is, all of us are drowning in the same gutter. Remember, all of us are drowning in the same gutter, and I can see 210 people counseling each other with fingers crossed and telling each other to have that faith and to have that confidence. Because see, now the same kind of motivation that you're giving to others, you have to just stick on to that for yourself also throughout the day. So although all of us have left our boat, we are not sailing any longer. Although all of us at this point of time feel that we have drowned in some really horrible stinky gutter, but remember, what are we, even in that gutter, even in that drowned sort of thing, drowning in the gutter, what are you aiming out for? What are you looking at? We are looking at the stars, we are looking at the sky, we are looking at the aim that we set for ourselves. So maybe today is not the best day where I don't feel that I'm sailing or I'm anywhere good in life, but tomorrow, the aim that I had set for myself many years ago, tomorrow is the day, and I cannot do injustice to my dreams and to my hard work by thinking in a negative manner. So faith over fear, one thing. And while drowning in the gutter today evening and tonight, you are still, remember, aiming for the stars. So I don't know whether something like this exists, but yes, drowning in the gutter and aiming for the stars is a new mantra that we've probably made for ourselves at this point of time. And that is how everyone and every phase of life is going to be. Every time you'll feel that you've hit your lowest and you've come to the bottom low of your life, but you'd never stop aiming for the best that you had thought for yourself. And that is exactly what you have to do at this point of time. One more advice, and this is not to be taken in a literal manner. I'm not saying that you're in any kind of a hangover, but hangover does kill you, literally also, and in the exam also. What do I mean by that? Many of you gave INI-CET, most of you gave INI-CET. Did you waste at least a good 2 to 3 days thinking about the exam questions? Yes, you did. Most of you, I know you did, because every class I would be teaching, you'd be like, ठीक है मैम, पढ़ाओ तो ठीक है, that is fine, but what was the answer to that T cell B cell वाला question? Ma'am, what was the answer to that NK cell वाला CD94 वाला question? So these are the kind of things you used to ask me, whether I was teaching path or micro or images or anything on this planet. The side comment section used to be, ma'am, T cell B cell क्या था? What was that endocrine tumor? What was that NK cell marker? So these kind of questions were constantly coming. So did the hangover kill a good 2 to 3 or probably 4 days of your life? It did. So now what do you have to do? Same happens in the exam. Hangover, I don't mean a long term hangover, question to question hangover. I got a question on an ECG and I don't know that question. I got a question on an X-ray, I don't know that question. I have left the question, or I have decided to keep it for review. But now when I go to the next question, I have got a very simple question. I've got a question on, say, apoptosis. I know apoptosis like on my fingertips. Apoptosis sabko aata hai. But right now I'm not even able to attempt this, because in my mind what is going on, that X-ray or probably that horrible biochemistry cycle that I've forgotten, or that pharmacology drug that they've asked me and I don't know. So this hangover which you guys practiced for INI CET, please don't follow it question to question. Remember, you snap out as soon as you click next. When you click next and you go to the next question, it's like you snap out of the previous question. The previous question does not exist for you any longer. Tunnel vision, guys. Only the question in front of you is the question that should be going on in your mind, and nothing else. See, I'll give you a very simple trick. Everyone has some or the other problem in life. No one has a life which is going in a smooth manner and a happy manner. Everyone has these kind of, this is how life goes for all of you. But you've hit the best phases of your life, you've hit the worst phases of your life. COVID has shown all of us probably the worst phase of our life. Postponement has shown you so many bad phases. Did you stop studying with all of that going? Did you give that a back seat, and did you ultimately put your best foot forward and focus on that one question that was in front of you? And that is exactly what you do. Please remember, there should not be any hangover of previous questions. Even if you've got 2-3 questions incorrect in a row, you've not heard of them, the fourth question should be treated as the first question of the paper. Remember, every question in the exam is your first question. You have nothing and no idea of what you've done earlier. You have no idea of what you're going to do later on. You have to exude that kind of confidence. At this point of time, the confidence with which I am talking to you, you might feel that, ma'am, aap to kar sakte ho na, you don't have an exam tomorrow. No, that's not how it works. The same kind of confidence I want all of you to emit till tomorrow morning. And I'm not saying or calling it overconfidence. I'm calling it faith, and I'm calling it trust in yourself and your preparation and your hard work, and the hard work that people behind you, the sacrifices that people behind you have made. Maybe it could be your family, your parents, your spouse, your kids, your siblings, your friends whom you've not met in ages. They also have made a lot of sacrifice in bringing you to this particular stage. So now at this point of time, if you fall for these traps of, ma'am, पढ़ नहीं सकते, and if you get to them and say, they will be very disheartened that, so many years we've been watching you and you've been putting so much, and now when you come back and say hoga nahi, and I don't think this is my time, maybe next year, when they hear, it's very heartbreaking for them as well. So, and it should be very heartbreaking for you also, because the amount of effort that has gone in this, if you come back to me and say that, ma'am, hoga nahi at this point of time, I would also not buy that kind of a statement, because I have seen how much of hard work you guys have put in, and this hard work has to pay. I mean, I'm not giving it any other option only. This hard work, it has to pay, and that is what you have to say to yourself also. Kaise nahi? You don't have to say nahi hoga. You have to ask yourself, kaise nahi hoga? This has to happen. I mean, this is what I worked for, and this is what I have to snatch from God and snatch from the universe, because I have worked day in and day out amidst COVID, amidst the postponement, amidst all my problems in life. I have fought for this, and if I have fought for something, I cannot fall weak one day before the exam. exam, not happening at all. So don't give yourself an option. See, simple life mein, if you give yourself an option, you will always go for the weaker option. That's how the humans work. If you give yourself two options, we will always go for the weaker option. And when you don't give yourself any option in life, you have only one thing to do, you will work towards it. When you feel that acha theek hai, next time ho jayega, never mind, big deal, no, that is something we'll think after tomorrow na. Till tomorrow, it is only one option. This is my exam, this is what I worked for, and this is what I have to achieve. There is no if and but, and there's no other way that God has made for me. And all the other bad stories we'll think after tomorrow, right? Okay, so having said that, uh, okay, so Dr. Ipsita, okay, any other session? Theek, actually, there's one more session which I had only planned because I somewhere knew that, although early morning I will meet you guys and I will, try to give you a lot of positivity and try to take you away from the anxiety. But honestly, these kind of words, I also watch motivational videos, all those videos that keep going around on YouTube and Instagram and all those places, that when I also feel that something is not going fine in life, I scroll through those reels. And I am also a big time social media addict, so I can't get my hand off Instagram reels, and majority of my life time is wasted in all those nonsense things. But when I look at those for the first 1 hour, I feel that yes, this is exactly what I wanted to hear in the morning, or this is exactly what is needed for me to move ahead in life. But after 1 hour, I am back to all the negative thoughts that I could possibly think, and all the bad things that I can think that can happen on that important day of my life. So these kind of motivational talks only last you 1 hour. Honestly, abhi 8 o'clock hai, by 9 o'clock you will be writing to me that ma'am, that good feeling is back in the throat, lump in the throat, something in the stomach. So all those kind of thoughts will come back by 9 o'clock. So as I said, no motivational speaker or no teacher can drive you beyond a point. Beyond a point, it is only you. It is only you, yourself, and what kind of a mindset have you made, what kind of thoughts that you have made for yourself. So if you make yourself that strong, make yourself that strong and that capable, that I am going to survive through these 24 hours, you will do it. And if you say that maybe not, and if you're only relying on others for that kind of motivation, that motivation has a t half of probably only 1 hour. Honestly, the t half of motivation is only 30 minutes to 1 hour, but the t half of self motivation is infinity. It will go on a very long way. The t half of others motivation is only motivational stories and success stories. It is only and only going to be half an hour, 1 hour. Okay, but still there is we would definitely, any questions guys, anyone has any questions, please Dr. Ipsita, don't worry. Many of you, we have two ways. Some of us express that we are feeling anxious and panicky. Some of us are just totally numb, and I can see some of you are expressing and some of you are writing out that ma'am ऐसा feel हो रहा है, ऐसा भी feel हो रहा है और वैसा भी feel हो रहा है. मतलब I'm feeling 20 things at one time and I'm writing it all down, because why not? Expression is the best way to relieve yourself. But then there are a lot of students I know who are probably just numb, and they're like, ma'am, I'm so numb that I cannot even type and explain what is going on in my mind at this point of time. So we have two set of people, just as we define as extroverts and introverts. We have those two set of people everywhere in life. So either of the two that you are, I hope these words resonate with you, and through the day they help you going. And just if not, we thought, I don't know if it's a good idea or not, so suit yourself. But because I think this is a time when no one would be studying, and we are not going to meet you to make you study. कोई mnemonics नहीं पढ़ेंगे. We are not going to study anything about any topic which I would want to tell you last minute and scare you, because you will feel ये तो पढ़ा नहीं या आता नहीं. Just when I say doubt clearing session, only doubts about exams, or just actually a sit and talk kind of a session. It could be a sit and talk. get your favorite event in life, or just get something that you just wanted to say, something off the exam, not so that I want you to forget about it, only because I want you to come back to normal life. And when you come back to normal life is when you will actually feel that, yeah, my the normal human life I've come back to, maybe I'm human enough to go tomorrow, because right now you're in some other world, you're in some kind of a trance, and you feel that you won't be able to do it. So you know I'll be meeting you again at 8, and I'll also have Dr. Neha ma'am and Dr. Siraj sir with me. And like I said, all three of us will not teach you anything of PSM, pharma, path, micro. We will only sit and probably listen to you. So if you are the expressive ones and you feel that I'll get a lot of positivity if I just vent out all my anxiety in a message, write it down. If you feel that you just want something like a chit chat session, sit, talk, listen, maybe like I said, maybe another 200-300 of us who will be drowning in the same gutters by 8 o'clock in the evening, maybe all of us can also sit and sulk over how we have almost drowned and now the stars of the sky are no longer visible, because by evening I think you will be going into one step ahead of that. So in case if you feel comfortable, you can join us at 8 o'clock. No pressure, no forcing you, because at this point of time you are the best judge. Talking to someone helps, join us. Staying in your own cocoon, staying in your own shell helps. Suit yourself. So anything that helps you this time, be selfish. जो खुद को ठीक लगे, what works in your favor, please do that and nothing else. Okay. Yes, a lot of you have written one thing that is common, that ma'am, I feel everything is wasted. That is what you are feeling, that ma'am, all the hard work that I had put in and all the sacrifice that my family had, friends and myself we had put in, all of that wo waste ho gaya hai, and I am not feeling up to it at this point of time. It's very, very natural. That is why are we saying this again and again, that we are drowning in a gutter? Because we genuinely are. Because that's not that I'm not saying we are drowning in a gutter because you have not studied well or you have passed that time of studying. No, we are drowning because that's our mental state at this point of time. Knowledge wise, we are still at the stars. Remember, your knowledge which you are not probably able to analyze at this point of time because of all that fear that has taken over you. So fear is like this big shadow which has like shadowed over everything that you had studied. So right now you're not able to see all those things that you had put in, all the efforts and hard work nahi dikhega. Right now you can only feel that big shadow of fear, anxiety, pressure that has taken over all of you, and that is normal. But that is exactly what you have to remove. You have to come out of that shadow, you have to come out of that shell, and you have to remind yourself of, like I said, remind yourself of all the positivity, remind yourself of all the accomplishments and all the good things. You were probably the best student of your class. You were probably the most hardworking intern in your batch. You were probably the topper of your class. You were probably even small accomplishments. Maybe there was a anatomy dissection hall. You were the best. You were the first year student who used to do the best dissection. You got 10 on 10 in some ward leaving exam. Minor to major, remind yourself of all the good things that you have achieved in life, because every little thing that you have achieved is going to work in your favor tomorrow. And if you remind yourself about, अरे उस एग्जाम में तो 5 marks का क्वेश्चन रह गया था, या वो एग्जाम तो पढ़ के ही नहीं गए थे मैम, we didn't study only, we just went, we watched a movie and next morning we went and sat in the exam and then we flunked. Now it's up to you, which way do you want to mold yourself into. I think you are very smart enough, and you know that this point of time your mindset has to be towards the good things that you have achieved, because they will take you towards better things that you have to achieve tomorrow morning, right? And 10 minutes of deep breathing is something which, trust me, as you get old in life, as you will age, the one thing that you will swear by is deep breathing. Everywhere it helps you. You are having a bad day and the person sitting next to you is damn irritating. You don't want to, beat the shit out of that person. Deep breathing helps. You have an exam the next day, you are facing anxiety. Deep breathing helps. You are at your workplace and your colleague is really irritating. You have to go in for deep breathing. If you are at home and your family is constantly pressurizing about you, आगे क्या करना है, what have you thought about your future, Deep breathing will help you. As you get old, your family will pressurize you. When are you planning to get married? Deep breathing will help you. So anytime and every time in life, what helps you? What is the basic mantra in life? Deep breathing. Breathe and let go. Rather than reacting, rather than venting out everything, breathe and let go. So remember, this is, if you learn, the earlier you learn this in life, the happier that you will be. So try that journey from today. Start that journey from today, from NEET PG. That is, breathe in, hold, breathe out, and just let everything go to hell. Say, I don't care, I don't give a shit about it. That is exactly what you have to say to each other and to yourself at this point of time. Koi abhi someone calls you and says, "Are you're not studying?" I am studying all 19 subjects today. What will you do? You'll take a 10-second pause, breathe in, breathe out, and say, "Good for you." That's it. Ideally, this is the best way of dealing with everything. Do what you can, good for you, and I'll do what I can, that will be good for me. So remember, yes. And I think, I hope, why have I been able to point out very relatable things is because each one of us has gone through similar events at a different magnitude. सबकी लाइफ में वही आता है, नीट पीजी आता है, उससे पहले प्रॉफ एग्जाम्स आते हैं, उससे पहले देयर इज अ हार्ट ब्रेकिंग ब्रेकअप दैट एवरीवन हैपेंस, उसके बाद देयर इज मैरिज दैट एवरीवन गोज थ्रू, then there are family problems that everyone has, then there are financial problems that everyone has. These are a set of 10 problems that everyone faces in life. NEET PG is one of those 10 problems for a medico. So everyone, like I said, everyone has the same 10 problems but at a different magnitude. Someone will have NEET PG once, someone will have to face NEET PG twice. So the magnitude for that person has changed. Someone will have to fail once, someone will have to fail twice. मैग्नीट्यूड हैज चेंज, बट प्रॉब्लम सबकी लाइफ में सेम है, तो सबका सोल्यूशन भी सेम है. एंड व्हाट इज द सोल्यूशन? ब्रीद इन, होल्ड, breathe out, and don't give a shit about it after that. So that is exactly what you have to do starting today, not just for tomorrow, for all the years of your long life that you have ahead of you. This is your to go to mantra, trust me. Okay, so yes, having said that, all said, I hope I am been able to at least come, like I said, half life of someone else's motivation, only 1 hour. तो at least 1 hour अभी अच्छे से कुछ पढ़ लो. Please go through the volatile topics for 1 hour, 2 hours. After that, maybe you can start that self motivation. You can start that deep breathe in, breathe out exercise and survive yourself through the days and through the rest of the day. And then finally at 8 o'clock, we will be there to extend the tea half by another few hours and to push you till morning. At 8 o'clock, we'll be meeting again, right? And yes, one thing I hope you will remember through this: positive thoughts only going forward to through the rest of the day. 60 70 70, first hour, second hour, third hour, that is what you have to follow in terms of questions. Review minimal, don't leave everything for review, don't be the kings and queens of procrastination, at least for tomorrow during the exam. Eliminate options rather than moving on to one option. Eliminate the options, that is ideally what you should be doing. And the first answer is the best answer. Instinct and common sense are the best. Overthinking and curiosity will kill the cat. Remember, curiosity always killed the cat. Don't be an overthinker tomorrow, right? Okay, minimum questions. I never give a number to anyone. Many of you say, ma'am, 180 plus to attempt karke aayenge. Some say 170, ma'am, I think. I'll say analyze the paper. Attempt, don't, like I said, don't be in a hangover of 200 questions. Go question by question. अब जो question कभी नहीं सुना, it's a random disease or a random, they've asked you the incubation period of some random disease which you've never even heard of, nor have you heard of all those days and weeks of incubation period. You're never going to get them right. Leave that question. Don't make such wild guesses, because over there nor your common sense will work, nor your gut feeling will work. वो तो छोड़ना है, वो सब छोड़ेंगे. Everyone is going to leave that. But where do you overachieve, or where do you become a little aggressive? Where 2 options you've ruled out and 2 options you're stuck with. You're stuck with 2 options. That is when you think and you play a little aggressive and you probably mark the best one that you feel out of those. But options where you've not heard of anything, those are the questions that you leave. So that is how it goes. Okay, one more question. Good in GTs but horribly in INICT. देखो, INICT and NEET PG का comparison where do you have to do it and where do you don't have to do it? Firstly, where do you have to do it? That INI-CET was a kind of a mock test. It gave me the ability to understand how good am I with time management, how good am I with recalling the questions, how good am I with just dealing with the pattern of the exam. That is what you should be comparing it with. What should you not be comparing it with is the level of the questions. You cannot compare the level of the questions in INI-CET versus the level of questions in NEET PG. There is no comparison at all. Like for example, if you've given 10 grand tests, were you comparing the level? If you give 10 grand tests on 10 different platforms, every platform will have a different level and different set of questions to offer to you. So your marks will also vary accordingly. Some platforms will give you a very tough mock test, some will give you an easier mock test. So your marks will vary as per that. Same way you're comparing INI-CET marks with NEET marks is not working, right? Because the questions in INI-CET, the topics in INI-CET versus the questions in NEET are totally going to be different, at least in terms of the difficulty level. So, you are supposed to take the positive out of it and not the negative. You're not supposed to take the marks of INI-CET and say that I'll get the same in NEET PG. No, you're supposed to say that, ma'am, in INI-CET my time management was off. That I've corrected for NEET PG. In INI-CET I was very panicky, so I could not recall simple things. Now I'm trying to get my panic low. I'm trying to put my levels of panic low so that I can recall more things. And yes, I've got a basic idea of how to sit. It was like a mock exam. Take the positive out of it. Don't take the negative out of it. Okay, so right, and everything, we'll still have a checklist in the evening. What all should you have kept in your bag, and whether you have or you haven't, we'll still be there to remind you in the evening at 8 o'clock. I'll have Dr. Neha ma'am and Dr. Siraj sir with me. Feel free to join only if you're comfortable. Reminding you, we are not going to teach you anything academic. That is not our purpose of end moment creating panic amongst you guys, and I think you should also not be doing that. I'll be meeting you in the evening, and rest of the day we will try and keep the spirits up. And like I said, you are a bunch of really positive students, not only for yourself but towards each other. I've never seen students who are at this point of time, a lot of jealousy somewhere comes in and you feel that why should I do good to that person. A lot of students feel that way, but at least all of you who joined in, I've seen you guys are motivating each other. You're trying to pick each other out of that drowning gutter, and you're trying to pick and pull each other and move together towards the stars, right? So I think the goodness also pays back. That will also pay back. So okay, Dr. Ipsita, you have to travel 2 to 3 hours tomorrow. Whatever medicine that you've tried earlier for motion sickness, that is no, please don't go in for a new medicine which anyone randomly prescribes. If you have been suffering from motion sickness earlier and whatever has worked in your favor earlier, please try to go in with the same. And other than that, everyone should, for that matter, carry a basic paracetamol with them, because migraines and headaches are something that always trouble us just right at the spur of the moment. So it is something that you don't want to be asking or looking out for at the last moment. It is something that you want should be handy. Carry something very basic like a paracetamol. Carry, if you have motion sickness, carry your meds for the same. Carry a band-aid, and these are just basic 2-3 things which everyone should be having with them, because that's better safe than sorry, as we say. So it's always better to have things ready rather than creating unnecessary last minute panic. Okay, so yes, thank you for joining in. Only for this now, the students who have exam, please go away, leave the session. And for students who are still going to be with us moving forward, you are not the exam going students, you are just here to see that agle saal hamara bhi kya hal hone wala hai. If you are those students who joined in, then just for you guys, Unacademy Lite is something which takes care of test series. Again, students who have exam, go from here. Now you are not needed, you don't have to listen to all of this. Go study. I'll meet you at 8 o'clock. For students who are moving forward, Unacademy Lite gives you only the test series. That is one thing. Secondly, this is a calendar which is for everyone. All the free tests which are going to go on the platform already ongoing from 15th May. So you can see all the subjects. And guys, now you've seen the students who are going through that phase. Now you guys know what kind of anxiety and pressure kicks in. So it's better that you start right away and you do not unnecessarily keep procrastinating procrastinating. Now it's the time ke padna start kar do. You've seen how everyone is feeling so anxious. You will also, but at least you should be prepared for it. So certainly this is the free test calendar that is going on. Also, guys, we have daily, previous year question bank. Previous year question bank has been put up. So why am I emphasizing on this is maximum number of questions that you attempt is what is going to relieve your anxiety in the last days. Also, just in case we have any aspirants for UPSC CMS, Unacademy has started with that as well. And these are all the different subscription plans that are going on, be it the Lite, the MCQ wala, even the MBBS year subscription, first year, second year. First year has already started, second, third will also eventually follow. And these are all the different plans that are available. Okay, so yes, thank you so much. And for those who are saying that, ma'am, we will make you proud, I just want to tell you, you have already made me proud. So I don't need an exam or an exam result for you to make me proud. I am already I take all the pride, and I'm extremely proud of each one of you who's been, many of you I am now, obviously I know you by names. But yes, I take extreme pride in each and every student of mine, and that is never on the basis of how much you score in your exam. That is just on the basis of how much of effort and hard work you've put along in this journey. So I agree, everyone is very goal oriented, result oriented, but I am a person who's journey oriented. You tell me a person who's not got amazing scores in NEET PG, but you tell me a journey that person has fought through, which all of you have, I would have more respect and pride for that person, because somewhere we really undermine the journey and we are only focused on the goal, which should actually not be the case. So I am in any way proud of you guys. Tomorrow is just going to be the pride that you bring to yourselves, the acknowledgement that you guys were looking out for yourself. As far as my pride goes, I am already very, very, very proud of you, the least that I can say. Right. Thank you so much, guys. Study well, and I'll be meeting you again at 8 o'clock in the evening. I'll share the link of the session. If you're feeling comfortable, not slept off, maybe dinner time, want to join in, just see how everyone is crying over life together. If you feel that's going to ease you out, join in at 8 o'clock. Thank you so much. Study well. All the